Thank you very much for the kind introduction, sir. This is Google, undoubtedly the most popular search engine. It guesses what you intend to search as soon as you type the first couple of letters. This is Google Maps, which finds you the fastest route to reach your destination, considering real-time traffic. Social media platforms will correctly identify you and tag you as soon as you upload your photos. Luxury of self-driving and parking cars are already available in developed countries. So have you ever wondered how all this became a reality? The intellectual power behind all this. Ladies and gentlemen, this is artificial intelligence. Good afternoon, everyone. I'm Dr. Tharindu, a senior registrar in medicine. Today, I'll take you through this amazing technology as it is evolving to become the intellectual digital companion for us, the doctors. So this is artificial intelligence in medicine, our stethoscope of the 21st century. Along the way, I will introduce you to this term, artificial intelligence, and some of the basic technical stuff behind this technology, and how this promising revolutionary technology is going to apply to our field, and the potential that this technology holds to transform medicine in the future. And finally, some of the limitations that this technology has. So to start with, the term artificial intelligence was first coined in 1956 by John McCarthy, but the concept of computers stimulating this intelligent behavior goes back into 1950. It was first proposed by Alan Turing in 1950. So what is artificial intelligence? Basically, it means machines mimicking cognitive functions of human. So what are the cognitive functions that we have? Visual perception, speech recognition, especially learning, most importantly, decision making. So more textbook description for this term would be, artificial intelligence is the theory and development of computer systems able to perform tasks that usually were conducted by human intelligence. So before moving on to this subject further, look at this figure. So sorry for the poor clarity of the text, but look at the graph, the steep angle of the graph. So this figure shows the number of medical AI studies by the year from 2005 to 2020. This was searched in the PubMed.com. So as you can see, there's a growing list of publication on this subject in the form of academic articles. So it shows the interest in this subject in the current medical field. And it is expected that AI will significantly influence the practice of medicine in the future. So it is crucial, as physicians, we have an understanding of the basics of this technology. So before moving on to this new technology, I'll briefly explain the traditional programming. So if you look at this flow chart in traditional programming, usually a programmer is going to handcraft an algorithm, and we input data. According to that handcrafted model, computer will analyze that data and come up with a result. For an example, if you want to correctly identify cherries from apples, you can define a variable such as weight. If the weight is more than a specific value, it's an apple. Less than that, it's a cherry. But let's look at this example. Now, as you can see, there are a series of photos. Some photos, we can identify that there are muffins. Some photos, there are puppies. But what if we want the computer to correctly differentiate these two photos and label muffins correctly and the puppies separately. To handcraft a model to do this by a computer will be an impossible task given the number of variables that they might have to set. So this is where this new technology, machine learning, comes in. So it's a subset of artificial intelligence. It's a technique by which computers can learn from data without using complex set of different rules set by a human programmer. Look at this flowchart. As you can see, in this technology, first you have a learning algorithm where you feed the computer this learning algorithm with large amounts of data and the expected results. So the computer itself will come up with a model which has the capability of differentiating or identifying those data. So if you apply this model to new data, this model has the capability, without instructing them previously, just by learning from data, by itself will come up with the result. I'll further explain with this an example relevant to medicine. Now imagine we have a large amount of data. Some are fractured X-rays, some are healthy X-rays. So what we can do is we can use this learning algorithm and feed this algorithm with large amount of this data. So this learning algorithm will come up with its own model to identify what is normal X-ray of the hand. So when we feed this algorithm with new data and apply this, it has the capability to correctly identify fractured ones from the healthy ones and where the fracture is even. So let's, I initially start up with some of the applications of this technology already in other fields. Apart from those applications, this is applied in aviation industry for autopiloting and retail and e-commerce websites to know the consumer interests, and bank and finance to predict stock values, and many more in security and surveillance, sport analytics, even inventory management and logistics supply chain. So let's focus on our field, how this revolutionary technology is going to apply to the field of medicine. So these are some possible applications. One is preventive medicine. And since we start from the through the whole field of medicine, there are so many applications, even starting from the preventive medicine, online consultations, triage tools, medical imaging, pathological diagnostic, medication management, training, precision medicine, and even drug development. I'll go through one by one. So as we know, preventive medicine, prevention is better than cure. So unhealthy behavior increases the risk of metabolic diseases. So this is one of the applications of AI to this field. This application is called LARC, Weight Loss Health Coach AI. So what this application can do is it has a human-like conversation to promote healthy behavior with the user. So it will monitor the user's behavior and it will give human-like conversation with that individual according to his needs. So this application incorporates elements of cognitive behavioral therapy to execute this function. And it has proven in this paper, it has achieved results comparable to the human coaching interventions. So another aspect that this technology will be applied is online consultation and chatbot. We know when a person has a medical problem, it's convenient if they are offered advice while at home. So patient can have an idea about the level of urgency. So Babylon Health, based in UK, developed AI-driven consultation application where the patients can report symptoms through this application. So it offers course of action. It will compare these symptoms with available online the database, and they will offer course of action depending on the urgency. So this will help the patient to get sometimes the faster treatment, sometimes fewer trips to the hospital. So in the future, possibly treatment from their own home, depending on the condition. And they also have the ability to have greater access to their own health. So another important aspect is triage tools. In emergency medicine, triage is an important concept because, especially in sepsis, we know the time is critical for survival. So this AI-based algorithm, one of the algorithms, they accurately predicted the septic shock at initial triage. So they have shown it has significantly outperforms the clinical scores in screening septic shock at the emergency department. As a specialty, radiology will be greatly influenced by this technology in the future. So medical imaging, radiology is one of the fields which will greatly influenced by this technology. So one of the examples I took is this one, which is called DLAD. So it's called Deep Learning Based Automatic Detection. So this AI-based application has the capability of detection of malignant nodules in chest X-rays. So in this paper, they have found that it has outperformed physicians in nodule detection in these chest X-rays. And when used as a second reader, it enhanced physicians' performances. So this is one of the examples from that paper. So you can see in the left-hand side, X-ray shows a faintly visible nodule just behind the left cardiac shadow. So it was later confirmed by CT and the biopsy. Right-hand side X-ray shows how this AI-based application could point out the area where possible neoplasm could exist. So another aspect is pathological diagnosis. We know in pathology we examine the slides. So one example is LINA. So its name is lymph node assistant. So this paper describes the importance of having this technology in this field is these algorithms can evaluate every tissue patch on a slide. So we know that that will increase the tumor level sensitivity. So this paper describes that achieving higher tumor level sensitivity than the comparable slide level performance to a pathologist using this application. Another aspect is medication management. One example is this IQ app. So this is an AI-driven compliance monitor. So what it does is it will identify the patient by the facial recognition and automatically identify the medication that the patient is holding, and it will monitor the real-time ingestion of the tablet. So what are the applications? Possible applications are diseases with public health concern, such as tuberculosis. So you can directly monitor that the patient is adhering to the treatments. And other thing is participants in clinical trials. So we can make sure that the patient is adhering to the medications and the trial data are accurate. So next, another aspect this technology is going to involve is training. Caption Health developed AI-guided ultrasound software. So this software allows doctors to perform cardiac ultrasound without specialized training. So what it does is it gives real-time guidance how to manipulate the transducer according to the available pitch at that time. So we know using this application, they have observed that it provides guidance that of an expert sonographer. One new field in medicine is precision medicine. Basically, it means approaching diseases in the prevention side as well as treatment side, considering individual variability in genes, environment, and lifestyle for each person. So to do this, this technology has a great potential to develop this field of medicine. So one of the application is by Deep Genomics company, where they have developed an AI to identify patterns in genetic data and compare this with their medical records, and they are trying to link mutations to their medical conditions. Another company is on Compass. So it's again AI to match genetic mutations in tumor samples to ongoing clinical trials. The aim is to provide precisely targeted treatment for these patients for their tumor. Another field that will benefited by this technology is drug development. We know it takes many years to develop a drug and it costs billions. So we can fast track this process and reduce the cost by using the technology. So Atomwise has proven one such example. So they have developed a drug discovery application. So it's going to root out treatments from a database of molecular structures. One that they have done is there are 2 drugs predicted by their AI technology, which may significantly reduce Ebola infectivity. So as you can see, there are so many applications, possible applications for this technology. You might think that this is theoretically possible. It's not reality at the moment. So these are the AI in current practice in US. So these are FDA approved applications. As you can see, there's a large amount of around more than 30 applications now currently in practice in their country. As you can see, more than 2017, there is in the year of 2018, there are more applications are accepted. So this shows that the interest they have towards this technology and how fast that this technology is growing and coming into real clinical practice. So the next part of our journey is looking at how this technology is going to transform global health in the future. So what are the key issues in global health? One is inadequate access to healthcare. Other one is inconsistent quality of care, shortage of well-trained healthcare workers, and inadequate access to rapidly changing management standards. So the solution for all these global health issues potentially could be artificial intelligence in the future. So before implementing this technology to widely accept this technology, there are some key challenges that we need to face before implementing this technology. One is reliability and availability of data. As I explained you earlier, these applications need to be trained first. So they learn from data. So if we want to make a reliable application, we need reliable, good quality data, which is locally available. You can't apply data from another country, taken from another country to you can't apply that same data to the different country because they will be biased. So one thing is we have to change our normal paper-based documentation to an electronic-based documentation to get these data available for train these applications. Other thing is local validation is crucial. So as physicians, we need to understand the basics of technology to assess the validity of these applications. Other one is the applicability and reliability due to possible biases. Another key challenge would be tools need right set of practitioners. So we need to have a familiarity with these AI tools and ability to assess their validity, as I mentioned earlier, to properly implement these technologies. And there's a common fear that AI might replace doctors in the future, which is a misbelief. So to address these, first we need to address these issues before implementing this technology. And another major obstacle would be health systems lacking the regulatory capacity for these new technology, because we know there's inadequate regulatory capacity even for traditional technologies. So AI-driven systems will create a complex regulatory challenges in the future. Finally, what are the limitations of this technology? One is unexplainability of AI models. Now I told you that the model is created by the computer itself by looking at large amount of data and the expected results. So that even the developer doesn't understand how this model is drawing its conclusions, because there are millions of learned parameters by itself. And some experts describe this as the black box. But we can validate this black box by providing it with the local data and validating that the app is working normal. Other one is trust. Because of this black unexplainability, patients and medical professionals gaining trust will be a limitation. Another important aspect is privacy, confidentiality, and data security. We know we need access to medical records to go ahead with this technology. So they have proven that even data is anonymized, individual profiles can be traced back, even they are anonymized. So we need to pay more attention towards these privacy, confidentiality, and security problems which might arise because of this technology. Other important one is biased AI. Because one example is in the United States, they developed an artificial intelligence program for the criminal justice system. Then they use this in the real life. Then they observe that they try to predict the tendency of a convicted criminal to re-offend. So when this is put into practice, they found that the app is disproportionately finding black people committing future crimes. There's a high probability. So as you can see, another example, I'll tell you another example. One is Amazon HR department. They used another application to sort job applicants using this technology. So they found that this smart algorithm favoring men most of the time. So this biased AI is not because the fault of the algorithm. It's because the data that we have fed it to learn. That's why I told you to implement this technology, first we need to have quality data to train these softwares so that the bias will be eliminated. Another limitation is diagnostic errors. One example is I told you the aviation industry already they have this technology. Boeing Max airplane crash. It was because it happened because of a faulty machine-driven decision overriding actions of a highly trained pilot. So we know that there's a chance of greater potential in a large scale if we do not monitor these technologies and implement them correctly. Other one is liability. If this kind of a technology make a mistake, who will be held liable? The doctors or the creators and the companies. So to conclude, AI will come to a status of everyday medical technology if policymakers develop policies that favor adaptation of this new revolutionary technology, and the medical associations give clear guidelines on implementing them, and the medical community does not look at it as a threat, but rather as a stethoscope of the 21st century. However, unlike any other field, core of the medical profession is still and will be human touch, empathy, and compassionate care, which are almost impossible to mimic through a programming language, how much intelligent they may become in the future. So are you ready for the new era in medicine? Thank you. I would like to thank College of Physicians, Ceylon College of Physicians, for giving me this opportunity to talk today. And I would also like to thank my supervising consultants, Dr. Ranjit Jayasinghe and Dr. Kishan Jayasekara, for their immense support. Thank you very much for listening.
Thank you very much, Dr. Kanakkahewa. We can have some questions. There's nothing from the audience, but from the online audience. But if I can ask a question, it's a very interesting topic and probably something that will become more and more developed in the future. But what you spoke of is about learning systems, AI systems, which learn by looking at a large amount of data.
Yes, sir.
But don't you also use a hybrid with there are two ways that a machine can analyze data. There are two ways that a machine can take a decision based on.
Yes, sir.
One is what is called an expert system. An expert system is where you feed information based on knowledge that is already there.
Yes, sir.
That is, you are an expert. The machine is taught to be an expert in the subject. The second is what is called a neural network, which is a learning system. So it's exposed to patterns of information, and based on the patterns, the more data it sees, it develops those the patterns evolve.
Yes.
So you didn't mention anything about the incorporation of an expert system into the learning model. Could you elaborate on that?
Yes, sir. Usually, sir, I describe about the artificial intelligence. Inside the artificial intelligence, there are another system. So machine learning is one. It's a subset of artificial intelligence. Even inside that, we have that deep learning, which incorporates artificial neural network. So which acts just like our neurons, finding multi-layers. It has multi-layers, and all these mechanisms use statistics to come to a decision. So what they do is, the most powerful technology would be this new technology, which is deep learning, artificial neural networks. So they are the one who is analyzing these pictures, sounds, speech recognition. So that is the system which has the capability to do most of the new advanced stuff.
Thank you. Any other? Do you get any of these systems being used here in Sri Lanka? Not yet.
No, sir. If you use an Apple Watch, there is, because they detect atrial fibrillation.
Yes.
It's approved in FDA.
Yes.
FDA.
It's a rudimentary system,
Yes.
but it's something.
Yes.
Yes. Any other questions? Interesting topic, but I think it's slightly outside medicine. That is why there aren't many questions. So
Yes.
people are learning something completely new. So thank you very much for enlightening us on something which is new and unusual. That's very interesting. Sir, do you have anything to ask?
Yeah, I think one thing you highlighted is that the need of a local data.
Yes,
because
sir.
the algorithm uses what's called big data.
Yes, sir.
And then unless you have got a big data which is locally generated,
Yes.
and then you can end up with a real mess really, because that is should go hand in hand with that, with the development of this kind of technology, and there should be another mechanism to generate that data.
Yes.
So I think that is, he highlighted that quite adequately.
Yes, sir. If we want to implement this in the future, maybe
Yeah.
what we have to do in Sri Lanka is having locally available electronic data, which is highly reliable. Then only we can implement this, but we can't adapt it directly from a foreign country. We have to apply this to our data.
Yeah. My understanding is there are a couple of local companies in Sri Lanka
Right,
and dealing with big data. Big data companies are there in Sri Lanka, so they're working on that.
Right. In the absence of further questions, I will call this session to a close. I'd like to thank the two speakers, Dr. K.K. Sandeepa and Dr. Tharindu Kanakkahewa, for their excellent presentations. Dr. Kanakkahewa, there is a certificate. And so before we wind up, I'd like to thank the following people for their contributions to the Young Physicians Forum. Dr. Priyamali Jayasekar, who is the organizer for the Ceylon College of Physicians, the staff of the CCP, the judges, the audiovisual team and the staff of ClinMark, and also the sponsors who this time it's CIPLA.